Hello, everybody. Welcome back to another episode of The Root of the Matter. I am your host, Dr. Rachaele Carver, and today we have the pleasure of speaking with Tosha Kozloski, who is a registered dental hygienist and a consultant. I met her at a Biologic Dental conference, and we had a great conversation. She was showing the microscope and she did my sample, showed me it was pretty good. But she helps practices transform their approach to periodontal care. So gum disease, and is really good at teaching these newer modalities that we love, such as the microscope and salivary diagnostics. We've had one of the owners of Bristle Health on to talk to us a little bit about what we can do with saliva. And that field is exploding because we're using saliva now for cancer diagnosis, like all sorts of great. It's wonderful because it's not expensive, it's non-invasive. So that's super exciting, right? And her, like me, we resonated really well because our primary goal is prevention. And we know it's so much easier to prevent disease than it is to treat disease. And since maybe a lot of people say 80% of disease comes from the mouth, we know that oral bacteria is a cause of heart disease, right? Kidney, liver, colon cancer, dementia, anywhere that blood flows, right? Anytime we're chewing and swallowing, that bacteria is getting to the rest of our body. So the whole point of this podcast is showing that oral connection to disease. And the coolest thing about our profession is we have a very accessible area to work on, right? It's a lot easier to treat gum disease in the mouth than it is to treat, say, colon cancer or any other kind of intestinal inflammation. Thank you, Tosha, for coming on. Why don't you tell us a little bit about your story, why you got interested in dental hygiene and how it transformed into this consultant job?
Yeah. Like all of us, I guess it's an evolution, right, Dr. Carver? I don't think I ever set off in hygiene school to want to do all the things that I'm doing today. But as it goes, one thing leads to the next. And probably from sixth grade, though, I was always a nerd and wanted to be a dental hygienist. My mom was a dental assistant, always loved going to our local dentist, lived in a tiny little town in rural North Dakota, one dentist for all the rural community. And I was no stranger, lots of cavities growing up. Both of my parents had significant gum problems. So my dad had severe periodontal disease. My mom had a lot of restorative decay issues. And just not because they were lack of caring or they didn't take care of their teeth. It was just, there was something more going on that they didn't know about. And so therefore, with us being the children, we had a lot of those same issues. And so when I got to hygiene school, I just thought, man, Perio is where I'm going to be able to make a difference. Working in GP practice is just going to be healthy prophies all day long. I'll probably get so bored with that. Little did I know, we all face Perio. No, it doesn't matter where your practice is, even if it's a pedo practice. And so once I graduated, I really wanted to work for a periodontist, got lucky enough to land a job working for a periodontist, simultaneously worked for a GP practice, 3 doctors, 10 hygienists, lots of contrast there, right? But what they had in common were that most of my patients bled all day long. And what I did at the Perio office was preparation for flap surgeries and different things like that. If somebody was referred for periodontal disease, we're talking stage 3. These were not easily restored mouths. These were patients that had lost teeth due to gum disease, collapsed bites. All on X wasn't a thing 20 years ago. But even if it was, I think back to it now, and I'm not really sure how easy some of those patients could have been restored with that anyway, because everything shifts, right? Periodontal patients don't lose teeth all at once. It's little by little, all kinds of things are happening. And so I just got really curious about, man, there's got to be a way. It can't be normal for all of my patients to bleed like this. And so within a year, I just thought that everyone bled. It was normal. And then I finally had a patient and I wanted to treat with scaling, root plane, all those traditional diagnostics. But I finally had a patient that looked at me one day and she said, Tosha, what do? I don't want to lose my teeth. And I was like, I literally had no idea. She had gone through scaling and root planing. She was one of these patients that spent 20 minutes easily twice a day, immaculate home care. She was diabetic. Even recommending scaling and root planing felt wrong because I was like, what am I going to do in there? There's nothing to clean off. So fast forward, I moved to Tennessee, found a doctor that was as passionate as I was about Perio and found out about saliva testing. So started doing saliva testing in 2008. That was a game changer. I immediately thought, of course this makes sense. All of a sudden that really made sense. And I really did see patients getting better, bone regrowing without LINAP, without laser, without any advanced technology truly, except for just a better understanding and going after the bacterial infection, understanding the host immune system and that whole piece. Then a microscope was introduced to us. And that was a bigger game changer than salivary diagnostics, simply because so many patients looked good. And then you would look at their slide and it was that connection.
Right.
It was that all infections start subclinically. Just like if you get strep throat, you don't all of a sudden have strep, like you have to come in contact with it. Your immune system doesn't fight it off. And so that was the aha moment for me and for my patients.
Pause for a second there, because everything I say is amazing. And this is what I think is such the game changer, because so often we look at our patients and like, they're fine. They're not, their gums aren't, they're fine, but they're not. Like you said, I talk to patients and my kids all the time about the bucket, right? You don't really develop a symptom until that bucket is full. You've been adding in those toxins, you've been adding in all the stuff. And then all of us, it feels sometimes all of a sudden I have a symptom, like for instance, my eczema, which brought me on this journey. Like it was building for years and years. I didn't all of a sudden, it felt like it all of a sudden I had all these rashes all over hands, but it was years and years of all sorts of things, right, building up. And then the perfect storm, right? Because it's never just one thing, right? It's just the combination, the immune system breaking down, right? Because our bodies are amazingly adaptable. We can heal from almost anything. So when we're prevention, we want to look at what are those root causes, right? And so even for myself, when we first started doing the SILHA testing, I was like, whoa, why am I showing protein and white blood cells in my saliva? I'm like, I have perfect gums, right? They never bleed. I don't have any cavities. Like everything is good. But that was really the key to me. Wow, there's something. And as most of us, we're always dealing with trying to heal our guts, keep them as clean as possible. So I was like, I'm always working on that gut. So that to me, when I do that SILHA, which is a screening test, I'm looking for evidence of inflammation. And I see that, I'm always looking, okay, we've got that. Because in my opinion, which maybe you share this, the gum disease, that is a systemic problem. I believe it's autoimmune. Yeah.
It doesn't, they're not just like hanging out here and going, oh, I'm just going to swim here. We have 60,000 miles of blood vessels. I tell every hygienist, if you see any bleeding, not bleeding on probing, any bleeding in there, why is the gum tissue essentially getting a paper cut? And if it does, then anything that's in the mouth is going to be circulating the rest of the body. We found Porphyromonas gingivalis in the brain. We found these types of bacteria in the clots of patients that have had heart attacks and strokes. How did they get there?
Exactly. And why we have ignored this connection for so long is baffling. It's easier, right, for everybody to stay in their own little box. We super specialized in medicine and dentistry, and everybody just stays in their box, where we need the doctors of old, where we used to, hey, the whole body's connected. How do we get back to nature and all stuff?
Yeah.
So when you first talked about when you moved to Tennessee and you were starting doing, what were you looking for in these the saliva tests? I assume maybe it was like the oral ID kind of thing. What was that showing?
So with the saliva test that I used initially, like the first one was eventually it was sold and now it's oral DNA, but it was the precursor to that. It was Hygiene Diagnostics that came from Germany, brought here, and the lab was in Germany, and then you shipped everything to them. But when we first just did saliva testing, we saw positive signs and symptoms of periodontal disease. So I was still very much limited to my traditional diagnostic parameters, not quite realizing that I was being very reactive. But when I was being reactive, I was seeing such great results when I did take that patient through therapy and didn't just try to remove the debris that really had nothing to do with the infection in the first place. But to pass your clinical boards, you need to be able to get rid of all that gunk on the patient's mouth and teeth and mouth. And it was really more when I got the microscope and we started taking slides on everyone and looking at their biofilm, that all of a sudden it was a game changer, simply because I saw patients that looked great. They didn't have any bleeding points. They didn't have redness and inflammation, but they did have spirochetes, amoeba, white blood cells, all these things that they shouldn't have if they're healthy. And those were also the patients that I would do my full mouth probe chart. And I would say, everything looks great, Dr. Carver. We'll get you shined up and we'll get you out of here. And then I would see all this bleeding. And I thought, oh my gosh, what do I do? Oh, sorry, Dr. Carver, I was wrong. What do I do now? Oh, by the way, I'm halfway through my appointment. I don't have time to convert this into a difficult prophy. Back then, we didn't even have a gingivitis code, which still is very misunderstood, but we didn't really know what to do anyway. And for me, I thought, well, this patient already does a great job with their home care. What more can we do anyway? I didn't know. I just didn't know. And so once I started to see that bacteria and I could show the patient, wow, these bacteria actually living inside your gum tissue, not just on top of it. You came in contact with these somewhere, parents, partners, pets, contaminated food and drinking water. We don't know. But what we do know is that your immune system is not fighting them off because we're seeing them here. And so now this is what we need to do. So I was able to create a lot more proactive plans than always just chasing these infections that have a lot of times been there for decades.
Mm-hmm. Yeah. And interestingly, what in my research, what I found is that's what we used to think, that you got it from this person, or people say, well, my parents had it, and so therefore I have it. What I believe that is really you inherit kind of your ability to detox well or not, right? So it's not that you necessarily, and yes, with parents and everything, we swap saliva, we swap. Ideally, in a healthy person, you should have, to think that we never have bad or red complex bacteria is a fallacy. All of us have this bad, even in health. It's when it gets out of balance.
Yes.
So the way that we think about it, again, especially if you're thinking this is an autoimmune kind of issue, in my opinion, a lot of times it's when that gut, because we live in such a toxic world now, right? And if we're not detoxing those toxins well, or we're eating a diet that's not right for us, right? And it's creating inflammation, that inflammation, the gut is one same lining, right? So we could be having a gut infection, which then changes the environment in the mouth too.
Absolutely.
So we shift. Now, the whole environment, this is what we talk about, like that terrain theory, right? So the germ theory is, which is what conventional dentistry is built on. It's a germ, we kill the germ and everything's happy. But we know that not to be true. And with the beginning of salivary diagnostics, we would be like, why I turned away from it originally is because it didn't matter what the results were, that the recommendation was always antibiotics. And I'm like,
always.
I was like, yes, that kills the stuff, but I'm like, why did it become imbalanced in the first place? So we're going to nuke everything. But then also, what are we doing to all the gut bacteria with those antibiotics? There's a lot of negative consequences for just blasting everything. And you're not 100%. Really addressing why the imbalance happened in the first place. So it goes deeper. And this is why going to the dentist every 6 months or more is so vital to your overall health. Because we need to, if all your oral, and we see this, like you just said, all the time, people have impeccable home care. So why does the disease persist? Because it's deeper, right? And again, is it diet? Is it deficiency? Stress?
Yes.
Everybody's got stress. So you got all those issues. And when we have a lot of stress and when we have a lot of toxicity, that creates deficiencies. So everything gets out of whack, right?
Yeah.
So let's say you have the patient come in, and again, their oral care looks great. You're not concerned necessarily with anything. And you do the microscope, right? So you swab, it's super easy to do. You just swab around the teeth in a couple places, put it on a slide. So what are you looking for when you are looking in the microscope?
Yeah, so I'm strictly looking for shapes. And I don't know based on the shape what that bacteria is, for example. But what I do know is certain shapes are part of your good healthy guys that help your body stay healthy. And then there's others like spirochetes, amoeba, trichomonas. We shouldn't find those in health. We shouldn't find those in high volume, high motility. So we're really looking for the difference. Is this a low volume, low motility? There's not a whole lot going on. We've got short rods, we've got cocci, all the things that we learned in biology. That's part of that initial biofilm. But as the biofilm matures, it starts to transition into those gram-negative rods and all that kind of stuff. And so when we see those changes, we know that there's already a significant imbalance. And in periodontal disease, we know that some of those more harmful toxin-releasing bacteria, because like you mentioned earlier, we can have some of these bad bacteria without being sick. But it's whether or not they're releasing a couple different types of toxins that drive the inflammatory response. So there's definitely more to the story than what the microscope is, but we're looking for high volume, high motility, lots of frantic looking slide, because that tells me, hey, there's a huge imbalance here. But it really makes that conversation so much easier with the patient when they see all kinds of stuff and they're like, oh my gosh, that's in my mouth. it's a much easier conversation than trying to explain to them the entire oral microbiome and the oral systemic connection. For me, my belief is keep it super simple. Keep it so simple for the patient that they know exactly what they need to do in steps, and don't throw the kitchen sink at them at once, because then it turns into a New Year's resolution that by February, and most people have already quit. And so that's where I start with, okay, let's look at what this patient is doing now. Let's make some tweaks and modifications. If they have an extremely high risk slide, they have positive signs and symptoms, then we do need to take them through some medicated therapy. We need to get in those nooks and crannies, disrupt and disorganize the biofilm, help give their immune system a jump start, then figure out, what are you all doing at home? Let's take a look at your diet, and putting the rest of the pieces together. And I'll send them home with a water pick or something like that. So that can better disrupt and disorganize. Because if the patient has periodontal disease, many of those bacteria they're similar to MRSA in that they have that protective matrix material around themselves for protection. So if our patient is only brushing and flossing, and they do have these bacteria that are releasing these toxins that are driving inflammation, that protective jacket isn't going to be brushed and flossed away. Their immune system is not going to be able to get rid of it as easy, especially if they're already eating the standard American diet, microwaving their food in plastic, all the different things. So many things, it's hard to count. If they're wearing a CPAP, they're not cleaning it properly. There's so many different offenders to all of our bodies, and everyone's immune system is different. I've had patients with home care that is not very good. Their gum health is fine.
What's happening systemically, right?
Yeah.
So that it's so important. That person, maybe they are eating the right diet, right? They're doing all, they're sleeping well, they're not mouth breathing. There are just so many factors. I love what you say, because I know sometimes in our practice, when we do just the Silha and I'm trying to explain that gut connection, people can glaze over, right? And if you have an hour and a half tops in a pair, how do you get all that? And for me, I'm usually popping in while I'm treating other patients. So that's where I console with Silha, and a lot of the doctors, this is the biggest thing. Like, how do you have that conversation? Mm-hmm. So the advantage of the microscope is, boom, okay, they see it right there, because the Silha is great too. You actually see, when you're seeing your own saliva on that, that's even a bigger picture there. Okay, whoa, look at, so that Silha, we're seeing white blood cells. All right, we're going to swab. Let's look at this slide here. And my goodness.
Yeah.
And so let's say you have that person, okay, and if they are brushing and flossing very well, maybe even they're using mouth rinse, which I'm not a huge fan of, but you're seeing like the spirochetes and stuff like that. Mm-hmm. So walk me through, what is your first conversation with them if they feel like, you mentioned the biofilm, so you said you're going to give them a water pick. Do you recommend that they tell us a little bit about the water pick, what you might put in it, and why that's important?
Yeah. So with patients, I don't explain to them like I would explain to my clinicians and the doctors that I work with. I keep it extraordinarily simple. And so my verbal scripts, if this was you and I did my full mouth periodontal charting and I saw some signs and symptoms of inflammation, I would say, wow, Dr. Carver, I'm seeing some inflammation, redness, and even bleeding in your gum tissue. I'm going to take a plaque sample to see if there's something going on. Now we look at the microscope. Let's say there's frantic, all kinds of creepy crawlers all over there. Then most of the time the patient looks at them and goes, that's in my mouth. And then I say, yes, this definitely explains the inflammation I was seeing in your mouth today. So I want to connect back, like what you're seeing here is what I was seeing, because for the most part, these infections are subclinical. And some of our patients believe they've had bleeding their entire lives. So we have to disrupt their initial thought and also disrupt the autopilot of these hygiene visits too, because just like patients come in and they think they're going to get their teeth cleaned, they're just expecting that when they see one of us hygienists. It's not their fault. We've trained them that way. So we have to say, oh, I'm seeing a change, or, oh, wow, this is what it is today. And then I see that frantic slide. Then I keep it to some analogies that anyone can understand. I say, think of these bacteria like termites in the foundation of a house. They live deep inside your gum tissue, not just on top of it, which is why coming in here regularly, doing a really great job with your home care isn't able to fight it off. Like basically these bad bugs or bad bacteria, however the practice wants to call it. I leave that up to them, like, so they can, for their patient base, like, how do they want to say that? But for these bad bacteria, they've overpowered your good bacteria. So your immune system is really struggling taking care of them. So what we need to do is not that traditional cleaning. Think of the cleanings we've been doing, like a routine car wash. What you now need is the full detail, really spending time getting the nooks and crannies, places we just can't reach with the traditional cleaning. There's going to be some homework on top of it and several visits with me. So then I'm like engaging them into, oh, she found something different. He found something different. Now we need to do something different. So that's my initial conversation. Most of the time, the patient's like, okay, yeah, get those out. What do we need to do? But then I learned this from another biological dentist. The way that she explains it to her patient is we take a 3-tier approach. First is, what are we going to do for you in the practice? Second is, what are you going to do for yourself at home? And the third is your immune response. So that's when we can link back to their medical history. So first, what we're going to do for you in the practice, I'll explain to the patient, like that full detail includes, depending on what the practice has, ozone, laser, whatever it is that practice is going to use to help get that patient healthy, that's what it's going to be. For the home care piece, that's going to be the water flosser and then the medicaments that the practice likes. So I work with a myriad of practices. And so I, of course, have the products that I prefer. Normally they'll say, okay, give me the research, and I'll say, here you go. And then they'll be like, oh, okay. And then the third tier is really that immune response. So depending on what their medical history looks like, are they diabetic? Are they immunosuppressed? Do they have rheumatoid arthritis and they're also taking an immunosuppressant drug? Then we've got a whole host of things that is also going to be part of that equation. And I know this is not going to be a couple appointments and this patient's fixed. This is going to be perhaps a year of getting the patient to health. And every single time I'm going to take a slide so I can know if I'm decreasing volume, decreasing motility. So with the water pick, I don't have any relationship with water pick. I just love the water pick. I've tried a gazillion different generic types and you get what you pay for. And so I like that pickpocket tip. I have like Perio Break Cleanse is one that a lot of practices use. There's no alcohol. It's essential oils. It tastes really good. So compliance is excellent. It comes with a pump. So the patient could just do one pump to 300 milliliters of water and it's made to be used in the water pick. In a perfect world, everyone would go home with ozone water, but that's not a perfect world yet. I think we're going to get there, but we're not there yet. And so then they just run around and I show them like shape of a letter M on the top, W on the bottom, round and round she goes till the tank is empty. And so that's like my number one thing when the patient's going to start to penetrate the biofilm wall. Because if they don't start penetrating the biofilm wall, it's not going to be as good. The second thing is toothbrush technique. Don't just brush your teeth and gums, like brush all of it. Scrape your tongue.
You know what we do for that ozone water? We make ozone ice cubes. So we send the patients home with ice cubes so that'll last them a little while. So they can only take one out at a time. Because if we just give ozone water, we know over time that it diminishes.
Yeah.
So
within a couple hours, water.
So we bought these big silicone molds and we send them home with the ice cubes. So that's a really nice way to.
Yeah.
Everybody's going to have an ozone machine, which they're becoming. The podcast I just did was with Promo Life. So
they have that tumbler. Yeah.
At home, like they're making them very affordable. And if you have one modality at home, spend your money on one thing, ozone.
Yes.
What that can do to your whole body is amazing. So I also like their my new favorite powder. They have one that has ozone and it tastes really good. Some of the product with ozone, it can taste very chlorine.
Yeah, the oils, can be a little too much for a lot of patients too.
I'm a fan. It cuts right through that biofilm. So that's really exciting. So again, really important. What that water pick is doing, again, that regular brushing and floss can't do is break the biofilm. Just like you said, like how you described that. It's like a jacket on there, like the waterproof jacket. Nothing's getting through that. And I also love your analogy of regular car wash versus now you need to be detailed. I think that image is awesome. And that's so important, right? Same thing with the termites. Like we got to get deeper down in there where the brushing and the flossing cannot reach. So some of the other modalities, tell me how you use the lasers and ozone when you're doing perio treatment and why those are beneficial.
Yeah. So depending on what the practice has. So a lot of my practices have at least ozone water. A good number of them also have ozone gas. And then laser protocols, depending on the state, are going to vary. So if a practice has, let's say they have all the things. So if they have a laser and they can use it as an initiated tip, then what we're going to kick off the appointment with is they're going to swish with ozone water as their pre-treatment swish. And then they'll run around with their LBR, their uninitiated tip, because that laser can penetrate into the gum tissue up to 5 millimeters and stimulate those fibroblasts and start that healing process and really help to supercharge the good the immune system. And then from there, they'll use if they have ultrasonics, I try to, whether it's a Cavitron or a piezo or however they do, if they can use ozone water in that, it's like killing two birds with one stone versus one more step. And so for the most part, they'll use their piezo or their Cavitron or GBT, whichever they have, and they'll full mouth irrigate, disrupting any biofilm, breaking up any calculus, any debris, cleaning as well, like old fashioned scaling and root planing, but really focused on the biofilm. And then they'll go in with and then they'll do whatever fine scaling they need. And then they'll add the ozone gas, if they have that as well, to that entire appointment. So they would do that. And then if they also can initiate their laser tip, they'll finalize with that, because that initiated laser tip is like wiping away all the necrotic tissue at the end to then help again. And that heat also helps with the healing process. And of course, the gas is going to be able to penetrate into the tissue too. So it can get a little bit crazy when people have all the different technologies. I would say most don't have every single thing. So it's just going to depend on what they have. When I first started seeing bone regrowing, I didn't have all these wonderful things, and I still was able to see bone regrowing on implants, vertical defects, patients getting so much healthier, saying, I don't know what it is, I just feel better, or just other spontaneous recoveries, eye infections that they're going to have surgery from an ophthalmologist go away as soon as they got their oral health under control, because sometimes that's just enough to make them reflect and go, why do I have an infection in my mouth? Why do I have this imbalance?
Yeah. And when when we're doing these kind of things, we're diminishing that bucket, right? We're reducing that bucket. Yeah. So now once we take the burden, the immune system, take the burden out of the mouth, the immune system can get that eye infection and can get the other infections throughout the body. So again, that's why I think what we do is exciting, because it's accessible, and the patient can do things from home too that really make it, but it has to go beyond that brushing and flossing.
Yes.
And that's exciting. And what we're traditionally taught is once the bone's gone, it's gone forever. That's too bad. But we know, no, the body knows how to regenerate itself, right?
Yeah.
We just got to remove that infection. And the laser is so amazing. The red lights, that photobiomodulation, all that is so amazing for healing and stimulating. And we don't realize how much the body communicates via light. But this is why sunlight is so important.
Yes.
About it, because internal, and we think it's probably pretty dark in there, but no, photons, when we're absorbing photons, they are communicating in the cells. So now they have a lot of little devices that look like mouse guards, right, that have red and blue light on them, which I think is another thing that somebody can have to do at home, because coming to the dentist, the hygienist, for once every, I don't know, maybe initially every 6 weeks or something, or if you're regular, every 6 months, what are you doing in that interim? So there are other things that we can do, especially somebody who has any perio issues. What are the other things in biohacking? We call them stack. And so when you have the ozone plus the red light plus the laser, right, we're stacking all these things, which makes the healing and the recovery and all that so much quicker. So these things that you can add in without being sometimes when you're adding so many different habits, like people aren't going to do them. But that's why one benefit of having that microscope, when somebody actually sees all those weird things wiggling out, that might be a little bit more.
They're motivated. They're super motivated. I so much compare the microscope to intraoral photography. Mm-hmm. We wouldn't dream of, so many practices have a different, like scanners. There's different scanners. There's extraoral photography, intraoral photography. That's not just for us.
Right.
That's also to show the patient what exactly is going on. It's so much easier. And when our brain can visualize the problem, they automatically can visualize the solution. So if they see a bunch of stuff running around in their mouth and they go, like, what they want is it not to be. So bridging the gap is easier. So it's like, oh, you need me to do this at home? Okay, fine.
And it's so important because most oral disease is asymptomatic, right? We don't realize we have gum disease. We don't know we have an abscess, right? And sometimes even if it's a huge abscess, you bite down and it feels a little weird, but not necessarily painful, right? That's why we have to do radiographs, because there's so many things we don't see, yet they are a huge burden to our immune system.
Yep.
Just a list of pretty much every chronic disease, you can find a correlation to oral bacteria, right? Because again, like you talked about, some of those, one of the major toxins is LPS, like a lipopolysaccharide. We know that directly damages endothelial cells. which are the cells that line blood vessels. You get damage, then all of a sudden your cholesterol is going to go higher because that's the signal for the liver to send some LDL to patch up all the damage. But we know I get concerned when patients have infections in their maxilla. The roots of an upper tooth are very close to the sinus, which is one thin membrane away from the brain. So is it any surprise that we have oral bacteria connected to dementia? Right? We know we all talk about the microglial cells, which are the immune cells in the brain, and those kind of create these. We're always so worried about the plaques, right? The amyloid plaques in the brain, and drugs were targeted to get rid of these plaques, when in fact, the plaques are actually a result of bacteria causing damage and activating the microglia. So just like LDL cholesterol, bad cholesterol helps bandage up blood vessels in the periphery of our body, those amyloid plaques are protecting the infections in the brain. So we need to remove the infections, and then the plaques are creating issues. So you can think of that anywhere in the body. In oral bacteria and other kind of microbes in general are some of the major problems, right? And I say it all the time on this podcast, toxins and infections, that's what's causing disease. So let's stop blaming all these other things and let's try to, and that's why we need some of these better testing, right? So we have to honor the days when we're just the hygienist and being like, if you don't have bleeding, you're all healthy.
Yeah.
Because we know we have these other tools now, and we know the more we can prevent, the healthier these patients can be. So when you have somebody who is set up a regimen for them, how often do you want to see these? Obviously, it depends on the person, but generally when you're finding something, how often do you think they should be seen so that you can check on the progress? Or how often do you think they need the ozone treatment or the laser?
Yeah, it's always going to be based on how they look every single time that they come in. If somebody they have radiographic bone loss, they have that pocketing, so let's say they qualify for the CDT for full mouth scaling and root planing. So we're going to code it that way because scaling and root planing is inclusive of removal of toxins and microorganisms. The patient does not have to have calculus. They simply have to have roots to scale to code it that way. But calculus is just, if it's there, great, get rid of it. If not, don't worry about it. But they're going to come in for a full mouth treatment. So I train teams like, you may be focused on the debris, let's say on the right side, but you're still going to run around the entire mouth with the laser, with the ozone, with everything. And then you're going to tell the patient, I'm going to bring you back next week and we're going to focus on any debris, just like we would with a traditional cleaning, but we're going to get in the nooks and crannies on the left side, but we're still going to treat the entire mouth. We're going to get you back 6 weeks later. We're going to look at the microscope again. Based on how you look, good, bad, or otherwise, we're going to determine what we need to do next. If a patient still doesn't look good, then maybe they need to come back in another 4 to 6 weeks to then treat their entire mouth again. And then that's really where you can really tell so fast with just looking not just at their tissue, because obviously some infections are so subclinical, but if their microscope slide is already showing a significant decreased volume, decreased motility, you know that the infection is headed in the right direction. You know the immune system's taking back over. But let's say that patient's doing everything they're supposed to do. You've done everything you're supposed to do, and that microscope still looks awful. Now we need to investigate further that third tier of what do we do professionally? What is the patient doing at home? Let's look at their medical history. For me, I don't want to say like I drag this out, but sometimes if we give the patient too much information, they get decision fatigue and they're like, I'm just not ready. So I just share with them, hey, let's start with this. We're going to see how you're at in 6 weeks. And then at 6 weeks, depending on how everything looks, we're going to determine if we need to add anything, if you're on the right track. And I don't overwhelm them with that because I know I want you to be a lifelong patient and I'm going to work with you over time. At 6 weeks, if they're a hot mess, then maybe we need to take a deeper dive into the gut health. If the practice doesn't want to take a deep dive into the gut health, then we're always looking at who can you refer to? Or are you willing to do some direct to consumer products? Biofilm has tests and there's a bunch of different ones online, but there's all kinds of different things we can do. If we're not ready to do it in our practice, we need to at least know where we can send that patient to get that whole health coverage.
That's so important. And again, thinking back to all my still had conversations about patients. That's what doctors say to me. I don't know how to have that conversation and I don't want to overwhelm them. I don't know what to say. So the way you're doing it is so important. In that 3-tier, that makes so much sense here. Let's just start with the basics. If that's 6 weeks, I love that. So that's a good interval. At 6 weeks, we reevaluate. Okay, we're trending upwards. Good. Let's go 2 months now, right?
Yeah. Yep.
How we're doing it. As long as you keep treading it, our goal always is to get them back to once or twice a year cleaning.
Yeah.
But we've got to see that they're making progress and maintaining that, right?
Yeah.
So it's frustrating when you're in the confines of conventional medicine and the insurance system. The fact that insurances only allow you to do one side of the mouth at a time makes no sense. And that you have to have the patient come back 2 weeks later. Just like what you said, you can't ignore the other side, right? If you clean one side, what is there suddenly some weird barrier?
Wait, mom swept the floor over there. Don't touch that side.
It just logically makes no sense. So that's what I've told my hygienists to do. You still have to do all the ozone treatment and a little bit of laser on both sides. Yes, you can focus on one side and getting the calculus out for that side, but the whole, because you're going to easily just reinfect the other side. It's crazy. And that's why, unfortunately, so many patients are, so many biologists like are moving away from insurance because it's handcuffing up to be able to do what we need to do. And yes, it's frustrating. It gets expensive. And I had a conversation with a patient today. It was like, listen, he asked me if we could just do the cavities and not the gum disease. And he has severe radiographic evidence. And I said, one, if your gums are bleeding, I can't do a filling. It's not going to stick. And number two, I said, I am way more concerned about your gum health than I am about the few cavities that you have, because every time you chew and every time you swallow, you are pumping all of those toxins directly into your circulation, right? So I said, if money isn't, we will work with you. I don't want money to be a barrier to your overall health. So let's think about this of investing in your overall health, because again, all of this bacteria causes systemic issues. So by investing in this oral health, we're going to prevent a lot of money and time for future health problems. But it's hard to have that conversation because, again, money always gets stuff sticky, and if insurance doesn't cover this and that, what we are always trying to do is prevention. But it's hard, especially when somebody, it doesn't hurt. And so
exactly, that asymptomatic part is the trickiest part.
Yeah. And that's why the photographs and the microscope, like these are important tools to have to be able to show the value of kind of what they're, and especially when they come back and they can see, oh my gosh, I'm making progress. You're getting that good report card. That helps further motivate people to continue. But yeah, that's always the challenge. If something is not hurting and impeding their everyday life and it costs $1,000+, then that can sometimes be a hard pill to swallow. So that's what our goal is, always education. This is why I'm doing my podcast. It just create that awareness and helping people to understand that they have the power to have good health. We all have the power to be our own best doctor. I would love to never have to pick up a drill ever again, because everybody will have solved all of their health problems, and I will feel like I've done my job on this earth and I can go on to the next, whatever else is next, right? So
yes, absolutely.
So I think that's what I'm always trying to teach, and having people like you on, hey, we have these great tools now, and there's so much that patients can do at home now too. Red light has become so easy. You can go on Amazon and buy a red light for like $50 now. So that's really exciting for people to use that when if they do have pain or swelling or anything like that. It's exciting that they know that these tools are out there.
Yeah. But patients, when I've told so many people, you don't have to do all the things at once. Sometimes it just takes a little bit of helping the body, and it takes care of itself.
Absolutely.
It's just those little nudges, just little tweaks and modifications, and it's incredible what the body can do.
What do you think about? So typically we had in conventional medicine, it was like, okay, you can do your scalp cleaning, and then we're going to put antibiotics directly in the pocket, say Reston. How do you feel about those kind of antibiotics directly in pockets?
Oh gosh. So I am not a huge fan of Reston. Like for me, I feel like I would say the majority of the biological dentists I work with do some systemic antibiotics when the patient's just not getting better. And it's that weed, feed, seed model. Like, we've tried everything. This patient isn't getting better. And they're typically those very high risk patients that have diabetes, that they have multiple things. They have history of heart attacks, history of stroke. They're these patients that their body's been waving the white flag for a long time. And so it's fighting fire with fire, like chemotherapy, if you will. And so when it comes to localized, it's just like putting them in the pockets. For me, share with the practice, if they're already using that before they would onboard somebody like me, I don't recommend to start there because it's not a localized infection. This isn't a localized problem. It's a full body issue. But if the patient has a vertical defect, that's very difficult for them to hit with a water flosser. And it is just an area that's continually collecting biofilm that's maturing. Good. At 6 weeks, put some in there. Let's see how it goes as an adjunctive, but I wouldn't start there.
Yeah.
So
I think that's important. And that's how I treat my feet. But I have noticed somebody say we're treating with the ozone, which I love, but I'm like, in some areas, like one single pocket, right? Can't get. And I have noticed that when I use Arrestin plus the ozone, because ozone actually enhances the effect of antibiotics, I can get resolution of these little like perio pockets. But again, it is never my first course of treatment. But like you said, you have these recalcitrant areas that they're just not getting any better. And that combination, I've seen it a few times with patients, they will resolve things. And I was like, yeah. And I've had to come to, I don't know what the right word is, but the use of antibiotics for so many years, I've been like, just so against it, right? But even I had a patient come to me, she had a really major abscess with swelling. So she received some antibiotics and she said, that really resolved all my gut issues too. And I went, like, maybe I need to rethink this a little bit. Just like you said, the weed seed is, all right, sometimes maybe we do. So my daughter 2 years ago, she had pneumonia. Wasn't so bad yet, but she's had this horrible breath. And I'm sure she would love me telling this story, but and her teeth, everything looked fine in her mouth. And so like, there's something in her gut, like her stomach is festering something. This is so bad. And so when she got they tested her when she was sick. And so I brought her to the doctor because that's the only way I could get her excused from school for being sick. So I said, run all the tests. I love testing. I love to see what's going on. And I wanted to know, like, what is happening in her gut that's creating this issue? And so it came back that she had a specific bacteria that was related to pneumonia. She never developed any pneumonia symptoms, but that's what came back in the culture. And so I said, you know what? I'm going to give her the antibiotics. I'm going to do it. And let me tell you, it's been a year now, like that breath is gone. Yeah. So then I'm like, yep, sometimes maybe you just need to nuke it and start over, right? Now get her on the better diet.
It's so tricky.
Yeah. But I'm like, wow, okay. But I had to have that patient say it to me first for me to like, okay. So sometimes we get narrow-minded, whether you're conventional or biologic or whatever it is. So now I'm always trying to think, okay. And yes, obviously sometimes we need medication, and thank God we have conventional medicine and it's going to save us in an emergency and stuff like that. And we don't need to always poo it. But again, having an open mind that use it when
responsible antibiotics.
Correct.
Responsible, not overdoing it, because in dentistry we are super guilty of over antibioticing and over all kinds of different things, and we don't always need a sledgehammer. And I know a dentist that she specializes in fertility, and she, like, people come from all over the United States to help to get pregnant. We know that when it comes to infertility, it's not, we hear all about these preterm birth and all this kind of stuff, but it's not getting pregnant in the first place is a huge part of it. And that's the man and the woman. And so if they have a serious dysbiosis in their mouth and they have specific bacteria, we know that if they're releasing toxins and that whole cascade of events. And she said for 2 years, she was like, I just don't want to do antibiotics anymore. And she said she just couldn't get rid of the Fusobacterium. She couldn't get rid of some of the Porphyromonas gingivalis. And so she went back to it and just said, I just sometimes. And so what I share with practices is, you got to use a decision tree. Are you dealing with a 25-year-old or an 85-year-old that has a medical history that's so long, it takes you 15 minutes just to skim it? Are we dealing with somebody that's on immunosuppressant drugs? Or is this like a 45-year-old that was probably just burning the candle at both ends, not getting enough sleep, too much stress, like all the different things, and now their body is out of whack? Like, you can always do an antibiotic later if you're not getting resolved and you've used your decision tree of age and health and all the different things. At 6 weeks when they come back, put the whole thing together and then do it later if you absolutely have to. You can always wait.
And that's so important. What I'm always trying to teach and train people who work for me, we are not here to treat teeth. We are treating people. So we have to and we've always thought, okay, let's make a protocol, but we're like, it never works because everybody is unique. So you have these generalized ideas, but everything has to be tailored to the person. So now you hear all these things about personalized medicine. Yes, it's really, and why do all these pharmaceutical drugs have so many side effects? Because you're throwing one drug at all these different people who are completely unique beings. So of course you're going to have side effects, right? Yes. So we need to look at, I love what you're saying, right? Think about the person that you're treating, and that is going to have their decision tree, right? Or their protocol is going to look a little bit differently. So I love how you have the generalizations, right? Like the person who has so many systems, maybe they need that antibiotic, right? Because they're so far down the systemic inflammation trail that regular natural modalities aren't going to be powerful enough because the toxin load is so high that we need to nuke it a little bit versus, like you said, the 25 or best example, right, is that 45-year-old. I love how you said burning at both ends, right? I know nothing about that.
Me either.
Those of us who are like, we're just really deficient, right? We're not sleeping enough. We're not eating as well as we could. We're just deficient in a lot of minerals and all these kind of things. So that person is, you're going to support them a little better nutritionally. And so, okay, we need to be getting our sleep better. I think that's...
And if you do the antibiotic, you are killing good guys too. So you must have a protocol afterwards. You can't just be like, good luck.
Yeah, especially today, right? You're just not going to... The food is so deficient today that you can't... Maybe a generation ago, it would build itself back up, but our food is just so toxic. Glyphosate's everywhere. I don't think there's anything that's organic anymore because it's in the soil, it's in the air. Maybe it has fewer toxins and fewer pesticides. Everything's got stuff in it, right? Yep. So I love everything you're saying. This has been awesome. I think you've been giving us some really good tools. I can't wait to have you come in my office and help. We have all the stuff. So just working again, and really, we don't have the microscope though. And I've been on that sense for so many years because I'm like, how are we going to add one more thing? But then when I met you and you're a consultant and you train everybody how to do it all together, because nobody wants to have a 3-hour hygiene appointment. That's not practical. No. So I'm excited for you to come up to the office and meet all the girls. And we have a new hygienist starting, and she's super into all the biologic. And so I'm like, I'm starting her off good right from the top. Right. We're not going to teach. We're going to erase all the bad habits she learned and get out the ground running. So I'm really excited about this. But I think you've given us all some good tips and hopefully helping people understand why they might need to come more frequently, and how, again, we are here not to make more money off you by seeing you more often, but to prevent the future issues that we know are all connected to oral bacteria and their toxins. So I really appreciate you coming on today. Is there anything else we didn't mention that you want to tell our audience?
Gosh, I don't know. I feel like we hit a lot. So if they want to nerd out with me on Instagram, I'm at Tosh, tosh.care. I have at tosh.care. I have all kinds of good nerdy stuff there. So come check it out if you need a nerd boost.
And let's say there are other doctors listening and maybe they want to have you consult their hygiene department. How do they reach you?
Yeah, so they can schedule a call with me if they go to my website, which is just Tosh, tosh.care. So tosh.care. There's a scheduling link there, and you can just schedule a call and we can chit chat, and I can learn more about their practice and we can see if we're a match.
Yeah, I think it would be great if we could have universal treatments for everybody, and they're all a little bit for everybody. We have to individualize them. If we know all these great tools to use and see how valuable they are, I think that will go a long way to help curb all this chronic disease that we have in the world today. All right, everybody, I hope you got some good information from today's episode. And if you liked it, please share it with others. Help us create that awareness for everyone. And I hope you have a wonderful day. We'll see you on the next episode. Hello, I'm Dr. Rachaele Carver, a board-certified naturopathic biologic dentist and a certified health coach. Did you know that over 80% of the U.S. population has some form of gum disease?
Many of us don't even know that we have this source of chronic infection and inflammation in our mouth that's been linked to serious consequences like heart disease, diabetes, stroke, dementia, colon cancer, kidney disease, even pregnancy complications. Would you like to learn how to reverse and prevent these chronic debilitating conditions without spending a lot of time and money at the dentist? Join me for my 6-week course where I will teach you the root cause of disease. You'll learn how to be your own best doctor. Are you ready to get started? Let's go.